Hi, I'm Dr. William Starsiak, and I'm an osteopath. A lot of people don't know what an osteopath is, so quite a few of my videos are me explaining osteopathy in slightly different ways. And it's really an amazing practice that has such a tremendous gift to bring to the world. Its biggest gift lies in its ability to resolve the consequences of trauma. So if our development occurs perfectly, right? We have in the womb, there's no disruptions by chemicals or genetic issues or physical insults, and we're born and delivery goes beautifully and we never experience any sort of traumatic events, whether it be physical or emotional, and we get all the right food and we get all the right exercise, well then all of our systems naturally will be synchronized beautifully, right? We'll grow beautifully, we'll have energy, we'll fall asleep easily, and if we've taken care of our relationships, then we just are synced up, we're in the groove. I haven't met anyone who's had a life like that, right? We are all subject to some sort of difficulty, some sort of suffering, unexpected events, physical traumas, emotional, mental traumas. And we have this amazingly resilient system. So lower level traumas, our system has methods by which it expects those and it dissipates them, and they don't really leave a mark. But higher level traumas overwhelm our system's ability to dissipate those forces. And so some of that force actually deranges or changes some aspect of the system, or the body responds to that force in a way that helps it deal with the application of that force, and afterwards is changed by that response. So you see a slight little difference between the force creates the change and the response to the force creates the change. Both of those things happen. So tissue damage is the change that the force creates, and then the shock response and the holding in the tissue after a trauma, that's something that the mechanism creates as an adaptation in the moment to that force. So tissue damage, the body will heal if we don't get in the way, right? If we don't inject steroids into it, if we don't use NSAIDs to blunt inflammation, well then the body will heal those things normally for the most part. Sometimes it doesn't heal them completely, and nowadays it's usually because the healing process was blunted by some sort of medication. But the shock trauma response, that stuff tends to hold in there. And even after the body heals the damage from an injury, there is generally also some imbalance in the tissue tension, because the ligaments were originally balanced kind of in this perfect balance of tension that holds the joint in its ideal neutral position. And in that position, the joint has its least wear and tear, its least friction, its least resistance to motion. So the ligamentous balance is perfectly synced with the shape of the joint so that it can guide the motion perfectly. And then after an injury, that ligamentous balance is disrupted through a combination of the body's response in the moment of the injury, the shock response, and through the actual physical damage that's done by a physical injury like that. And we know in medicine, so all of us agree, MDs and DOs, we all agree, if you get a bad injury to a joint, that joint is more likely to get severe arthritis and may need to be replaced. That's accepted. So we know something happens during the injury, and then over time, it develops into severe arthritis. So let's fill in those gaps. This is well known within osteopathy, but it's not fully appreciated within the MD world yet. And I think you'll be able to follow me through this really easily. So I already explained how the trauma can create an imbalance in the ligaments. So if you have any doubt about this, all you have to do is talk to someone who sprained their ankle. If you talk to enough people who sprained their ankle, you'll find that a lot of them, once they sprained it once, it got easier to sprain. They would sprain it again and again and again. And this is because the balance of tension in the ankle ligaments was changed. So when you roll it, the outside stretches, the inside doesn't. So then afterwards, the outside is loose, the inside is not. And so the neutral position changes from one of the foot being, parallel with the ground to one where the foot, if this is, say you're looking at the right foot, and this is the outside, this is the inside, the foot rests like this because the ligamentous balance has shifted. The outside's looser, the inside's tighter. So you get this compensated position. And now you do that in the foot, well, that changes how the fibula sits, the amount of force on the fibula. And it's also going to change how the force goes through the tibia. It's going to change the rotational component. So it's going to change the knee, and it's going to have an effect up in the hip. And frequently I see an ankle sprain showing up as pain in the same side SI joint. So it has a local effect, and it also has a distal effect. Now, of course, if you imbalance the ligaments and then you run the system, there's more friction, there's more resistance to motion, so you're going to get more wear and tear, you're going to get more inflammation, and over time you're going to get more adaptational changes, arthritis, osteoarthritis. And if it's a bad enough injury, you leave it alone long enough, eventually you're going to have to replace the joint. So the really amazing gift of osteopathy is, hey, we can step in there after the injury. So the body's shock response can be felt. It's dense within this. The body normally, when it's uninjured, unlesioned, is fluid and whole. And Dr. James Jellis created a system of teaching osteopathy that's just beautiful, and I lean on that system a lot in my explanation. So, he talks about the fluid body, not the only osteopath who did. There's legendary ones, but he does a really good synthesis of all of the osteopaths who came before. So normal is this fluid wholeness. We see that originally in the embryo, and as the embryo divides, it's to maintain that fluid wholeness, and the integration and synchronization is really important. So an injury appears to disrupt that. So there's some region of tissue now that's like a withering field. It's not getting enough nourishment from the blood. It's not as fluidly tied in. And we can then go to that region manually once we feel that density or that difference, and we just basically fine-tune the structure till that fluidity returns. So what's happening? Well, we're rebalancing the tension. So the tension became imbalanced, and what we're doing is we're following ease to find where that tension rebalances. And when that tension rebalances, it opens up this door to this fluid sea, this potency, and it flows into that dense region, and it begins to let go and release and then reintegrate with the surrounding tissues. And then the ligamentous imbalance is less. Sometimes it'll go away completely with one treatment. Sometimes we need multiple treatment till we get to this point where the asymmetrical tension totally lets go into the fluid wholeness of the body. And then we prevent this whole cascade of other problems out into the future. I see a lot of my patients 20, 30, 40 years after the event that was the cause of their problem. Someone slips and falls on their tailbone. They're ice skating. They slip and fall on their tailbone. 20 years later, they have a disc herniation. The number of people that I see with disc herniations who had a fall on the tailbone, it's in the 90%. A compressive injury was what sets up the circumstance for later herniation, unless you just have one really bad injury and the herniation occurs in that injury. But usually you get a compressive injury with a bit of a twist in it, and it strains a particular part of the membrane that keeps the disc in, and then over time the strain is not fully repaired as it's used, and so it gets weaker until you get a bulge and then eventually a herniation. So we can address these things right after they happen. We don't have to wait until they grow into this big old nasty tree bearing all this stinky fruit. But the problem is in our culture, we're not aware of the consequences of injury. We're not as educated, just general culture, on, okay, you get a bad hit, what is that doing to the connective tissue? We have a lot of thinking about the muscles and thinking about like popping joints, but it's really the system that's maintaining these traumatic responses is ligamentous and fascial. The muscles are more reactionary. So muscles will try to help the problem. They'll try to counter the deeper problem. And then if they try to counter them long enough, eventually they start to hurt. And so usually the muscle that's hurting is not the problem. It's actually the one that's trying to solve the problem. It's trying to pull things back to the neutral, the previous neutral. So this approach is really different than anything else other than the approaches that came from osteopathy, like indirect myofascial release. So when we follow the E's, we find that ligamentous balance that leads us to the fluid balance, that leads to the release of the traumatically held tissue and the reintegration of the structure into wholeness. And with that generally comes more energy and a feeling of just like emotional ease and satisfaction and peace, because these physical strains, they actually bind up a bit of our mental emotional energy as well. And when you reintegrate those, it's like people feel more like themselves. They feel more flow and ease in their lives. So this is something that would be great if more parents knew about this for their children, because you get some sports injury as a kid, you're not getting paid, you're getting some benefit from playing sports, but really it's for fun, it's for socializing. But then you get some sort of serious injury that now can change the landscape of the rest of your life. Like, it doesn't really seem fair. Like, it's just a sport, it's just for fun. And then here's someone who's now got deal with headaches for 20 years because of an injury that happened, playing football or conking heads and playing soccer. And because culturally we don't know about this osteopathy, that people don't recognize it and rely on it, these things end up going untreated. But if we get someone in and we treat them right after this injury, they don't have problems. And maybe this is part of what's hard about the situation, is proving that disc herniation wouldn't have happened if they hadn't had the fall on the tailbone, because the time separation is so big. It's hard for people to make the connection. I can see it from where I sit, because it's like I deal with it all the time and I see the correlation so clearly, and I see how well when we treat these strains, it goes away, it gets better. So it's kind of hard to prove, like, hey, if you'd gotten treated when you were 16 when this injury happened, then you never would have had this disc herniation. That's a really tricky study to do, right? You'd have to get a bunch of people who had falls on their tailbone, and you'd have to treat some of them, not treat others, wait 15, 20 years, and then see what percentage get disc herniations. And just no one's gonna pay for that study. So we have to do this more like clinical observation, anecdotally. So if I could, that would be a really cool thing if we could change that in our culture, if people became aware of the effectiveness of osteopathy in dealing with these things. Now, there are a bunch of other bodywork approaches, and like I said, a lot of them are inspired by osteopathy. I mean, chiropractics comes from osteopathy, Rolfing, biodynamics, structural integration, orthobionomy, indirect myofascial release. But if you get a really good osteopath, like someone who really knows what they're doing, they take it very seriously, they've delved deeply into the indirect work, the specificity that can be delivered to engaging with these strain patterns, with these lesion patterns, is unrivaled. Like, I haven't come across it with any other approach. Other approaches are good, they have their role, but osteopathy brings a very particular benefit, where these lesion fields that nothing else will touch, you engage them just right with ease, and they just dissolve and they reintegrate, and problems dissolve with them. I actually had this experience firsthand. When I was a little kid, I was hit by a breakfast cart in my nose bridge, and I remember back in second grade having neck pain. When I turned my head quickly, I'd have this like burning neck pain that would happen. And I didn't connect the dots then when I was a kid. But as I got older and I discovered osteopathy, I totally connect the dots now, and even can see it in my facial structure, the effect of that hit. Because it's a big cast iron breakfast cart that was being pushed at a pretty high speed because my siblings were playing with it. One was riding on top. So it had a lot of momentum because one of them, their full weight was on top of it. And I was the height of a breakfast cart. So I was pretty small. And at that point, the skull is a lot more impressionable. So I took a hit, kind of turned to my right, and then got hit like this. So if you look at my nose, the area that was hit actually got shifted that way relative to the center of it down here. And if you look at my temples, you can see that this one is oriented more this way, whereas this one is oriented a little bit more forward because this got shifted with it as well. So these forces, they imprint onto the connective tissues, and the connective tissues can have this shock response to it. If you ever see someone like in slow motion get kicked in the head or get punched in the head, you'll see how deformable, how much the body absorbs that force, and then some of that deformation remains. So in this work, we're finding those trauma residues. And it's kind of like they feel, this is an analogy I've started using, I love it, it works so well. It feels like there's a bow drawn inside of the person. Like there's an area of the tissue that's just holding this, or maybe it's not drawn, but it's compressed in, and it's held compressed in, and it wants to kind of come back out, but it's like stuck in. Or it's, pulled out and it like wants to go in, but it's stuck. So what we do, osteopaths, when we're doing indirect work, those things are dense, and so they find us when we're paying attention to fluidity. Density will stand out. Just like if you were looking for light, you're going to see shadow just because it's the absence of light. And then if we take over what they're doing, so if it's that drawn bow, if we take over that tension, we actually do it for the body. That's towards ease, and that's towards achieving balance. And then the part that was holding on in that way, once we take it over, it begins to relax. And as it relaxes, the structure becomes more and more fluid, and the balance of tension shifts a little bit. And we just follow that shifting tension, keeping it balanced until it reaches the open sea, until it dissolves into this. And now the attention from the practitioner is no longer drawn into that density, but it's actually now dispersed out amongst this whole fluid field in the body. And so if it was compressed, it'd be the same sort of thing. It'd be like disengaging it like a drawer that won't open, disengaging it, matching that compression just right until it all becomes fluid. And then that fluid like seeps deeper like a sponge that's dry and that's saturating. And then it releases out and it reintegrates with the body. And there's some other rules for, okay, once we get these things to release, we want to look at these bigger systems, these longitudinal motions, these lateral flux motions, where we can have regional releases, but then we want to make sure systemically everything comes onto this one page of just being like one fluid whole. And so that's another part of osteopathy that's a really big gift, is we're not just trying to break things free. We recognize that everything's place is relative to everything else. So it's not that we're trying to break something out of some sort of scar tissue, but we're looking to reintegrate the whole system, because the whole thing is alive. It's doing what it's doing for a reason. And if we start from that understanding, then we're going to be much more intelligent with our treatment. If we take this impression that like the body's confused, it's doing this stuff it shouldn't be doing, it's my job to come in and tell it what to do. You're over here, no, go there. It's the wisdom present in the system is unimaginable. And we can simply work with that wisdom by following ease. And the pathway is laid out. You just continually follow ease until the release occurs and these lesion fields resolve, the body reintegrates, motion normalizes, there's not as much resistance to the joint motion, you don't get as much wear and tear, and boom, all right? Now, that injury that could have developed into severe arthritis that would need surgery, they don't have another problem with it. They get it treated early on, it never grows into something like that. So know about osteopathy, refer the people in your life. If you haven't checked it out, check it out yourself. Hey, if you like this video, well, press the button, say you liked it officially, digitally, let YouTube know, and go ahead, subscribe to my channel and check out my other videos too.